Good afternoon to everyone present. My topic today is clinical complications and microbiological profile of Lacrimal sac as a sequelae to dacryocystitis. Dacryocystitis, as we know, is the most common disease of the lacrimal drainage system. When not treated appropriately and timely, the infection might expand and lead to permanent injury of the lacrimal passage. The aim was to the type of study was hospital-based, and patients, 25 patients above 10 years of age who attended the Department of Ophthalmology were taken as subjects. After taking a detailed history and complete ophthalmological examination for all the patients, demographic information was taken, results from clinical examination, inoculation of smears, purulent material and different culture media were all taken. At the time of presentation, as told by the patients, they were not taking any antibiotics. These are the reports of the different culture sensitivity pattern and microbiological analysis. There were two steps were done on diagnosing the patient, basically on strong clinical suspicion. Two swabs were taken. One was sent for gram stain and the other was sent for culture sensitivity. Since culture sensitivity takes a lot of time, so we could not wait for, most of the patients, they presented in an emergency manner. On the results, it was shown that most of the patients had a very poor hygiene. They were female and they belonged mostly to the tea garden indigenous community. My paper is mostly from Upper Assam, so it is mostly dominated by people who work in tea garden setup. They were daily wage earners, and the male percentage was 32. The most common presentation which was seen was watering and swelling, which was present almost in all the patients, followed by mucoid discharge, red eye, pain, and hyperemia. The most common isolate which was found was Streptococcus pneumoniae, and also other organisms like Aureus, MRSA, E. coli, and Candida albicans was also found.
I think 1A is.
The most common complications which was seen was lacrimal excess with a percentage of 60%, and then followed by cellulitis, fistula, and mucocele. So in this study, we found that bacteriological flora dominated it, which was similar to a study which was done in the southern part of Assam, where it was found that Strep aureus was found. In our study, we also tried to include the fungal culture, as only bacterial is mostly done. And here we found two fungal isolates were seen, and both of them were immunocompromised. There was one interesting case where there was a patient with bilateral lacrimal abscess. One organism was Pseudomonas and other was Staphylococcus aureus. I tried to take a photo of her, but she was very camera shy, and we had to convince her, but I could not get the picture, otherwise I could have shown. The limitation was, since the sample size was only 25, so it does not represent the entire demography of the region. And the spectrum, it varies with different geographical areas. So this is one of the very first few studies which have been carried out in our area for the antibiotic sensitivity and different presentations and organisms responsible. So in conclusion, as we saw, most of the patients were women belonging to tea garden area. So for this, along with Department of Ophthalmology, along with various regional and state level organizations, we have tried to spread awareness so that they can come and help us. They can tell the problems and we can help them treat. So these are the different paper cuttings for our awareness. Thank you.